Hello, and welcome to another video. Certain symptoms seem to come in pairs: nausea and vomiting, shortness of breath and wheezing, stomachache and diarrhea. Constipation and fever, however, are an unlikely duo. Except numerous parents and healthcare professionals note that when one is present, the other is too. Is constipation causing fever, or is it the other way around? It's a chicken and egg situation. We're answering this puzzling question and delivering up-to-date advice on treating fever and constipation in children. So, whether you're a concerned parent or just curious about this fascinating topic, watch on to learn more about what's going on. Constipation is a symptom-based disorder which describes bowel movement that is unsatisfactory because of infrequent stools, difficulty passing stools, or the sensation of incomplete emptying. Constipation is defined as having 3 or fewer bowel movements in the previous week. Alongside this sharp drop, individuals find that their bowel movements are hard and difficult to pass. In adults, constipation is obvious if you're straining or in pain during a bowel movement, if the feces are large, dry, hard, are lumpy, and if there's a significant drop below your normal number of bowel movements. You'll find similar symptoms in children. Children may experience less than 3 defecations in the past week, large and hard stools, stools that resemble pellet-like rabbit droppings, pain and straining during defecation, occasional bleeding post-defecation due to hard stools, and poor appetite and stomach discomfort relieved after defecation. In addition, diarrhea may occur in children younger than 1 as the runny stool leaks around the hard constipated feces, also known as overflow soiling. Parents may be able to feel a large, solid lump in the stomach of their child, a clear sign of a blockage. Before we continue, I wanted to let you know about our free AI symptom checker over at mychildshealth.io. Our trained AI symptom checker allows you to enter your child's symptoms, and it will then come up with a list of possible causes, allowing you to explore our articles to find out about the various conditions and understand your child's symptoms. Why not check it out today? A link is in the video description. The primary cause of constipation in people of all ages is dehydration. Most cases of constipation aren't related to any illness. Rather, a low-fiber diet and low liquid consumption work together to slow bowel movements down to a crawl. Usually, constipation is a temporary condition. Short-term changes in diet and fluids influence the digestive system. However, once these return to normal, the poo blockage is passed, and bowel function returns to normal. Chronic constipation in children, on the other hand, is suggestive of an underlying cause, such as insufficient fiber from fruit and vegetables, or poor fluid intake leads to nutritional issues. Lack of physical activity or sedentary behavior. Too much pressure or frequent interruptions when toilet training. Excessive anxiety or worry, due to starting a new school, bullying, or moving house. More complex causes are typically reserved for adults. However, children can still get constipation from an underlying condition, including endocrine disorders such as diabetes or hypothyroidism, nervous system conditions such as cerebral palsy, or certain medications. Milk allergies are also a common cause, especially if constipation occurs after cow's milk or dairy products are consumed. If the poo is particularly painful to pass, this can create a vicious circle. The child holds back more, leading to increasing constipation. Parents often ask, will constipation cause fever? Or, can constipation cause fever and headache? While constipation can cause headaches from repeated straining, it won't cause a fever or chills. However, a secondary cause of constipation, meaning that the constipation is caused by an underlying problem, can cause fever and chills. The most common culprit is an infection. Whether viral, bacterial, or fungal, infections tend to lead to a low-grade fever. Dehydration occurs as the body temperature rises, due to excessive sweating. Unless we increase our fluid intake, dehydration will occur and will cause constipation. That's not the only association. Two conditions also link low-grade fevers with constipation. These are diverticulitis and appendicitis. Diverticulitis occurs when small, bulging pouches in the colon, known as diverticula, become inflamed. While not normal, the presence of these pouches isn't usually a problem. However, if bacteria become trapped in these pouches, it leads to infection and inflammation, known as diverticulitis. This simultaneously slows your bowel movements and spikes your body temperature. However, diverticulitis is primarily associated with older individuals. In children, appendicitis is a much bigger concern. The appendix is a small offshoot of the bowel that becomes inflamed and infected when blocked with feces. While constipation and fever are common symptoms, the cardinal sign is pain in the lower right corner of the stomach. You should seek medical attention immediately if your child has all three symptoms. Appendicitis is a highly treatable condition, but it can have grave consequences if ignored. Is your child complaining of constipation while their temperature is spiking? If so, always speak to your doctor to get a checkup. In most cases, the cause is likely a passing viral infection. However, getting confirmation gives you peace of mind and ensures no underlying condition is missed. Treating a low-grade fever in constipation is simple. Drink plenty of fluids to replace any lost due to the fever. Eat high-fiber, nutritious foods. If the constipation is chronic and occurs without any fever, speak to a doctor about getting medications to help your child pass stools. These may include laxatives. These soften the stools or stimulate bowel movements. Examples include polyethylene glycol, lactulose, or mineral oil. Stool softeners. These make the stools softer and easier to pass. Docusate is a commonly used stool softener. Stimulant laxatives. These stimulate the muscles in the intestines to help move stool along. Dulcolax and Senna are examples. Osmotic agents. These help fluids move through the colon more effectively. Milk of magnesia and lactulose are examples. Enemas or suppositories. These are typically used in more severe cases of constipation or when other treatments fail. Children should never take any of these medications long-term as they can prevent proper toilet training. Always follow the guidance of the prescribing medical professional. Toilet training isn't always easy. Little boys are particularly troublesome. However, with a few simple tips, you can significantly improve the process and reduce constipation. Encourage regular exercise and physical activity. Babies should get at least 30 minutes of tummy time throughout the day. Toddlers need at least 3 hours of light and activity play, including moving around, skipping, hopping, running, and jumping, and preschoolers should perform 3 hours of physical activity, with 1 hour being moderate to vigorous activity. Always stick to a toilet routine. Training your child to go to the potty at a particular time reduces stress and anxiety. After meals or before bed are usually the best times. Keep calm. As a parent, it's easy to get stressed when your child is uncomfortable. In normal toilet training, a calm demeanor goes a long way. That's especially true if your child is constipated or passing an uncomfortable stool. Talk to your child. There's no better insight into a child's mind than the child themselves. Ask them how they feel about potty training and if anything bothers them. Ensure a good position. Passing a stool is all about posture. As an adult, it's easy to forget the basics. But keeping your feet flat on the ground, staying seated, and relaxing are all key to acing a bowel movement.